All right. All right, beautiful ladies. We are here online. Okay. Happy Thursday. Happy Thursday to all of you. I am here. This is Coach Malaika, and today, guess what? We are diving into natural things that I know that can help you feel your best. Okay. Either way, it's a joint pain, whatever joint issues that you may have today. Are you ready? Let go and dive on. Let's go. Okay, if you're watching me alone, say let's go. I got this energy today for some reason. Ladies, I got this so much of energy today. I'm telling you guys. So if you are watching, I want you to type let's go. Okay, let's go. So today, let's just breathe, take a breath. Okay. You guys want to see my funny face of me? All right, so we're gonna explore in this session. Actually, we're gonna explore natural remedy to pain management. I know what you're going through. I know that it's painful. I know it's hurt. Maybe your shoulder, maybe your knee, it may be your joint. I mean, something causes pain. Well, I am glad that you are here today because today we're gonna debunk and I'm gonna share with you things that I have tried myself and things that I learned from my precious grandmother, and also things that I learned from holistic nutrition as a nutrition coach, as someone that studied holistic. Okay, so let's start with understanding the pain. I think a lot of us, when we go through, we just call it, oh, it's pain. It's painful right now. I have pain. I'm going through pain. But just what is pain actually? Have you, maybe one day we just stop and ask yourself, what is pain? Why I am actually going through this pain? Like I always tell you guys, when it comes to holistic life, thank you whoever is watching, I appreciate you. Thank you so much for being here. When it comes to holistic life, you always want to go to the cause. Why I'm having pain. Don't stop on, okay, I'm having pain, give me something, doctor, so I can numb it. Okay, you may know me for a while, but doesn't mean it's going to be like that. That's why when we take ibuprofen, when you take Tylenol for something, it's okay for a couple hours, and then what happened? The reality show up again. So what is pain actually? So before we explore any remedy today, and if you don't have a notepad, I want you to have a notepad today because I want you to take notes. Okay, so pain is very important that we understand the pain is a very complex signal from the body indicating that something may be wrong. Period. Basics line. Like anytime you have pain either in your shoulder, that the other day what did I do? For some reason, yeah. Okay, so in my church I like to praise dance sometimes. And I think I was swinging the flags so much. So after that, I came home. My arm, this one right here, is kind of like, ooh. I said, oh yeah. It has been a while since I flagging. I would do a dynamic dance, but it has been a long time since I flagged. And just how our body is so integrated. Even though I used to do it, but now that I did it, it has been a while. My body felt it. Anyway, so I'm feeling the pain. I said, what is it? I was just, why I'm feeling the pain right here on my shoulder? Then I thought about it. I said, oh yeah, because I swing the flag for a while. But anyway, so what is pain? Pain is a signal from the body indicating that something may be wrong. It can manifest in many forms. First of all, we have from acute injury to chronic conditions. Okay, while medication has its place, many individuals actually, like you and I, are seeking for natural solutions to complement their treatment plan. I'm not putting out conventional medicine. Conventional medicine is needed. Right now, if I have a toothache and it's paying me right now and nothing I can do, or I have some infection going, hey, doctor, I need you right now. Give me whatever that is. Let me tell you guys a story, okay? You will laugh, ladies, and I want you to laugh, okay? I'm telling you this story because I want you to get it and laugh, okay? So this is me. I have two children, okay? I have my son, he's 19, and our daughter, she's 12. So my son was the first baby, and when I was pregnant, in my mind, or my kind of mind, I made my mind that I'm not going to take epidural. That's something that I already talked about it. I digest it. I make my mind, and I'm just gonna do it like my mom did back in Togo. All right. For some of you guys know, I'm from Togo. Yes, proud to be a Togolese. I'm from Togo, West Africa. So, and I was in the States. I was actually in Fort Worth, Texas. They have another story. I'm not gonna jump onto that. Make the story short. The day I'm having my son, okay? So I said, no epidural. I went through it. It was 15, how can I put it? 15 gymnastics. 15 hours of labor, ladies. No joke. But I refused. Why? Because here it was already made. I said, I'm not taking epidural. I went through it, have the baby. Fine. Now, my second baby, I was 33 years old. Now, something shifted. The body, different. Now, when I get to, I think I get to the hospital, I was already like 7 centimeters dilating, okay? And I just feel the pain wasn't the same thing. I mean, this thing was paining me. I felt like this baby was, I told the doctor, I said, listen, I'm about to go to the bathroom. I feel like I want to push. She's like, no, not yet. I said, something. And actually it was right here. For my daughter, it was right here. This place I am right here in Kansas. And I said, no, something is not right. This pain, I told her, I said, listen, I went through labor for 15 hours before. I know what it is. But this pain I'm feeling right now is not the same. Of course, you know them. They're going to try to, especially like in military installation. You know, sometimes you got people that come in to try on that. Now, I'm not saying that we don't have a good doctors in military installation. We do. But it just happened. I have a lot of people that are learning. So they went in, put the hand to check the baby. Ladies, they were poking my baby all in every area. And one nurse, she's like, oh, I'm feeling her nose so cute. I said, you feeling what? You feeling the nose? No, you got to be kidding me. Something is, for me, I knew exactly that something is not right. I said, listen, you are not supposed to feel the nose because you just know you're a woman. If you have a baby before, the baby is coming this way. Normally, that's the natural way of coming, right? So what happened? My baby turned. Instead of coming this way, my baby was coming this way. So every time they check me, they are feeling my baby nose. Oh my goodness. My baby came out with swelling lips, swelling everywhere, just swelling. You know how you can have a cute baby picture? My baby didn't have it. But this is my point I want to make. So before I even went there, I said, listen, I need something. Oh, I said, I need something that will help me with this pain because this is not the same. Because I think because the baby shifted, so the pressure is what I can feel every single ounce of that pressure. So now they say epidural. I said, oh yeah, give me that. Ladies, let me tell you this. When the doctor came and put the epidural and the pain subdue, I promise you, I start praying for whoever manufactured the epidural. I say, Lord, bless them. I thank you, Father. Bless this man. Whoever is a woman that discovered epidural, this is what I needed. Why? Because something was calming me. It took away my anxiety. So my point is, conventional medicine, when it's needed, take it. All right? Okay, now, let's go to diving into what can we do, you and I. What kind of power we have? Plenty power in the nature. God created the nature for us to help us, to serve us. We don't serve the nature, okay? We appreciate God created the nature so we can use it, all right? So, number one that I do want you to know is that let's begin with some and this I'm telling you, this is a well-researched. Thank you, Paulette, for being here, always consistent. This is a well-researched information, herbal medicine that I'm telling you, you can research yourself, that I am giving you right here, okay? So, number one is going to be turmeric. A lot of you guys hear about golden milk. It is excellent, okay? Deliciously, I'm telling you, is delicious, okay? So, turmeric, this bright yellow spice contains curcumin. That's the element called curcumin, known for its anti-inflammatory property. Now, I told you guys a couple of days ago that our body doesn't absorb turmeric well, okay? And like I told you that the supplement that I'm taking, the company kind of tricked the body a little bit. So when you put fat into your turmeric, whatever you are drinking, is a golden turmeric or just simple tea turmeric, please give me a favor. Drop some olive oil onto that turmeric before you take it. Why? Because turmeric doesn't work where the environment is not full of healthy fat. Or you just eat avocado and then take your turmeric milk. Does that make sense, lady? I didn't make this up, okay? Scientifically proved. So curcumin is consuming turmeric in the food as a supplement may also reduce pain associated with conditions like arthritis. Not only that turmeric is anti-inflammatory, but also, you ready for this? It can ease your pain. And I promise you, lady, it works. So like, from you guys know me by now, I don't like to take a lot of medicine. But that is the supplement that I'm taking. We have turmeric supplement that we are taking. And what the company does is wrap that fat around the turmeric. So when you be taking, your body say, yeah, you be, give me that fat. Swallow it, it works. A lot of you guys are taking turmeric maybe for years, you don't see the effect, you don't see the result, is because of this element right here, fat. Okay, so now what you're going to do when you take your turmeric tea, drop some fat, some healthy fat. Avocado oil is great, or avocado. Okay, so let's keep moving. Ginger, I can't talk this enough. Ginger. Actually, I make something this morning, which I'm going to post later for you guys to see. I have some fennel, F-U-N-N-E-L. You guys are going to be used to my accent a little bit. So I have that with ginger. I'm telling you, that's a good secret for anti-inflammatory. Okay, I'm going to show I'm going to post the video later. So ginger is another powerful anti-inflammatory herb. It can be used in cooking. I put it on my, like, a lot of things, like as African descent, a lot of things we make, we have ginger on it. Now I understand why my grandmother always, like in her, when we go to the kitchen, we always have fresh ginger on hand. Made into tea or taken as a supplement to help relieve musco. Okay, woo, this is a big word. I'm gonna try it. Okay, musculoskeletal. Ooh, okay, let me break it down. Musculoskeletal pain. Ooh, hallelujah. You guys know what I'm talking about, okay? You got it, okay? All right. So another one, number 3 is gonna be willow bark. How many of you guys hear about willow bark? I hear a lot of things about it. Historically used as a natural pain reliever, willow bark contains salicin, which is similar to aspirin. You know what? You're taking aspirin. You guys hear about when we grown up, you know, on, you know, like back in like I don't know, 80s, 90s, you know, aspirin is just one of those things. Something like in Africa, something happened, they say aspirin. Why? Because it numbed the pain. Okay, it numbed the pain. So is a similar. So willow bark is a similar, have a property as aspirin. It can be helpful for lower back pain or osteoarthritis. Okay, arthritis. Some of you guys have arthritis gone, and you don't want to take the aspirin. Maybe it may have another effect, because some of you guys, if you are bleeding, you know, aspirin is not going to be good for you, okay? Or other condition, okay? Aspirin can actually affect other medication. So now you know what can you take? Willow bark. All right? Okay. Now, we're going to also dive into essential oil that I want you. This, I have, like, if I turn my camera on, you will see I have, like, because also I do skincare and stuff. I have a lot of essential oil from multiple places. Last time that I get them from, where this place called? From, oh my Lord, from Hitland, and is I almost say delicious, but they smell amazing. Okay, I love that company. But anyway, you don't have to travel that much. You know, you can get them here, but just make sure that you get a good quality organic essential oil. So essential oil have been known, they are very effective for pain management, particularly when you use typically or in aromatherapy way. Okay, now you can consider peppermint oil. That's the one great one. Peppermint oil for its soothing and cooling effect. Peppermint oil can be applied typical to relieve pain, tension, headache, and muscles ache. Like some of us, we work a lot, or as we have in our joint, just use some peppermint, you know, put into your, rub them in. You know, when my grandmother actually, what she used to do when it was little, and it's so funny that this thing been existed for a long time. Like Egyptians are really like great when it comes to, you know, all of this natural stuff. Like she will rub them up, put them here. I don't know why my grandmother does that. She will put them here. Like when we get a cold, she will put them on our chest. Man, I miss my grandma. She passed away now, 2014. She will put it on our chest, our hand, our feet. Like if you have a cold, get something to have mint on it. I promise you, in a few minutes, you will feel much, much better. Okay? Now, another one is lavender oil. Okay? Lavender with its calming and analgesic property. Okay? Lavender oil can help alleviate discomfort and promote relaxation. That's why you see that when you go to spa area, people have it a lot, or you go for massage, you know. So because it works, okay? It gave you, kind of relax you. And also it's using like massage oil or diffuser. You can also drop into your diffuser and just let that run to the house. It's great. All right? Now, capsaicin cream. Some people probably hear about it. Is capsaicin cream. C-A-P-S-A-I-C-N-I. Okay? C-N-N. Not C-A-I. So, derived from a chili pepper. Watch this now. But you guys know that as menopause women, sometimes we don't want to eat. It's not like we don't like hot sauce, but because what it can do to us. All right. But do you guys know that as a chef, I'm bringing you guys up some other hot sauce that you can take. Yeah, I studied some peppers, and I found out there's a lot of pepper that we all can take without give us the capsaicin element. Okay, that's another story for another time. So capsaicin cream can be applied to the skin. It works by depleting a neurotransmitter involved in sending pain signal, providing relief particularly for joint pain. So let me tell you this now. Growing up, like I see my uncles, like when maybe they working on the farm and something happened, right? They get cut for some reason. I don't know why. Now that I'm studying science behind everything, I'm trying to understand. Like my grandfather would say, take a pepper and let them chew them. What they need to chew pepper when they are hurting? But just why it works. Couple minutes later, my uncle just like, oh yeah, I'm good. What? I think that's what it is. Because of capsaicin is inside. Every pepper has it, So when they bite that, just like going to your system, and what it does is it's depleting the neurotransmitter involved in sending pain signal. It's like, you are not welcome here, something like that. So provide relief, particularly for joint pain. Okay, now you can get you some capsaicin cream. Okay, now dietary consideration. I also want you to make sure what you are eating can affect your joint. If you're always snacking on crunchy and salty snack, just what? You're also gonna be dealing with a lot of pain, because all of this, they open yourself up to inflammation. Now let's go for a good one. Of course, my good friend, omega-3. Omega-3 fatty acids, food rich in omega-3 such as fatty fish, like salmon, mackerel, walnut, flaxseed. All of those are good for you. Can help reduce inflammation in the body. Fruit and vegetable, you can have that enough. I mean, you want to eat, lady, just make sure your plate is like, you got a lot of fruit and vegetable. We're supposed to have like a 3-7 of fruit and vegetable every single day. But a lot of us, sometimes maybe just only one throughout the day. If we get to have one. But you and I can do better, okay? We can do better. Like berries, spinach, broccoli are excellent antioxidant because they combat inflammation. All right, herbal teas. That's like when you come to my house, I actually have a pantry just for herb, and I get them from different places like Korea, Italy, Germany. I mean, I love tea from Africa. I love tea when my husband travel. That's one thing that I always bring back to me. If he didn't buy me anything else, he know they have to bring me some tea. So I have plenty of tea because I grew up with my grandmother. And you guys know all of those grandmother back in the days. The bushes is like the pharmacy, okay? So my grandmother, just behind our house, that's the pharmacy. And she always sends me to go plug this and plug that, put it on the pot, boil it, and I feel good. Literally, like sometimes we have stuff that we're going to fever, and she will say, go grab this one, go grab this one. I wish back then I have a note, take all of this. Since that I can remember, I'm still doing them today. But it's wonderful. Natural, God have a lot for us to learn and use in natural, okay? In the nature, that's what I'm gonna say. So now we're talking about herbal tea, certain herbal tea such as chamomile. Do you know when you're gonna sleep, you can't sleep. Put some chamomile, brew some chamomile and just drink that. You will sleep, okay? So chamomile is great that you can use. Also, we also have other teas such as green tea is great. Green tea is powerful. They have anti-inflammatory property and can be also suited for pain relief. Okay, like in the morning, use some green tea instead of coffee. Take a green tea. Now, natural supplement. In addition to dietary changes, some natural supplement may also support pain management. That's another big word I'm gonna call glucosamine and chondroitin, I believe. Okay, these supplements are often used to support joint health, and most of the supplements that are great company, you will see this thing. You will see anything that do with joint. I know you guys know this probably. You will see glucosamine on the pack, on the label, okay? Because it helps, all right? So you have that. It can help alleviate pain for individuals with osteoporosis, okay? All right? Or arthritis, I would say. Another one is Boswellia serrata. Ooh, I think I'm speaking Italian. So, as known as Indian frankincense, Boswellia is known for anti-inflammatory property and may assist in reducing pain from conditions like arthritis. Are you dealing with arthritis? Which I know a lot of us are because of our journey. Estrogen, we learned that this week. Estrogen is low, just what affects other part of our body. And joint is happen to be one of them. Okay? So now if you go, you can take Boswellia serrata. Can help you with your joint pain. Alright? Or if you do have arthritis, doctor already give you some medication. Ask your doctor if it's okay. You can combine. You can take that, and I hope you will feel better, because I remember my husband, he's in the military, as you guys know, some of you guys know, and running is one thing that they do. So my husband could run. I mean, to put his shoes is I said, oh no, we aren't gonna have that. So what I did is I put him into a supplement that I have for joint. We have that combo. I think I shared that with you guys, but if you guys want to check it out, my company has, not my company, but the company that I partner with, they have a what we call combo for joint pain. It has actually the turmeric on it. It also have a glucosamine on it. I mean, different herb, they mix them together and it's great work. That's the therapy I put my husband on for 3 months. And I promise you, ever again, ever, this has been like going to 5 years now, ever again have joint issues. Okay, if something gets so bad that you need something but you really don't want to take medicine for your entire life, let me know. I can send you the link. You can get that supplement. If you use my link, you get 10%. All right. Okay. Now, magnesium. Magnesium is, yesterday I explained to you guys the effect of magnesium and calcium. Magnesium relaxes you. If you take calcium, you got to take magnesium. Okay. All right. So magnesium also plays a key role in muscle function and can help relieve tension. Consider magnesium supplement if you're experiencing muscle cramp all the time. And sometimes we feel like our knee can get tight. You know, sometimes even like to bend your knees is an issue. Your body, those are sticking, your body is telling you something is not working, function. Maybe you don't have the mobility, you know, the flexibility anymore. And what you need to do, magnesium will relax those bones, those muscles. All right. Now, ladies, you have it. Those are various natural supplements for pain management. And if you have some question, yes, the wisdom of ancestors, yes, healing from the land is becoming a lot. Yeah, it is becoming a lost art, literally. And you know, my prayer is that we get today. Because sometimes I was like, today I was doing a video and I was thinking about what our great-great-grandmother, how did she manage the menopause journey? Because we all know she went through, including Sarah. Okay? So how they did it? Why now we are so accustomed to all of this disease around the menopause? It shouldn't be that way. I don't think that's what the Creator gave us to pause. It's for us to, you know, get to connect to ourselves and also get to pause and things that are really matters in our life. We can set those priorities. But I guess because nobody prepared us how to go into menopause. Nobody. Just like I was telling a friend, you know, the other day that, you know, people tell you train your child, you know, prep them for college, but nobody really prep the mothers how to deal with the when your son, your daughter leave home. Like I went through that a couple weeks ago, and I promise you, ladies, it's another hot flash to my hot flashes. But thank God I don't deal with hot flashes anymore. But I was like, wow, I miss my son. But you know, nobody, the same way with menopause, nobody prepped you. Nobody said, you know what, let me sit down and tell you this is gonna happen when you hit this. Let me prepare you. No. But because we don't have that pre-knowledge, some of us, we have anxiety going through because things just hit us left and right, okay? But you and I, we can do better. And I'm here to help you, to hold your hand. Every day we're here to bring you some information. Please use it. Everything that I'm listing here, I'm also going to have them as a guide. I'm going to post it on the page. When you do see those people, please go there and comment. And one thing here, lady, when you are watching, please send those love. I want to see them. Facebook want to see them because when we do that, you know what Facebook does? He will take our video and post it to where everybody else can be involved. Because see, if it's good for you, it's also good for somebody else. And that's what we are here for. So we can touch women all around the globe. Okay? So thank you so much for liking this video. If you like it that much, please go and share it. All right? Invite people to our page and let them see what the Lord is doing. I know once you hear, you are going to learn. And I'm praying for each one of you guys, ladies. I'm praying for everyone. As soon as you step into our platform, you are the prayer circle. I'm praying for you because I want you to live your best life. All right? So thank you so much. I appreciate it. I'm not seeing any question. And I hope that you guys how you call it? I hope that you guys are learning, and you guys are here not just hearing information, not just because a lot of us know we know what to do, but they're willing to do it. You know, and that's why I came in. I'm here to support you. I'm here to hold you as a coach, and I know you're gonna get there. Okay? Love you, and you are beautiful. Don't let nobody tell you anything else. Ciao for now. Bye.